Hi everyone, I'm Dr. McCall. I'm going to be teaching you Nursing 104 for the next 8 weeks. I'm looking forward to getting to know all of you. I've got some notes here that I'm going to refer to. I want to talk to you today about your upcoming assignments. So your assignment will be to create a short video on a physical assessment or a head to toe for a patient. By the end of week 1, you will need to have your practice head to toe or physical assessment done and submitted along with your consent form. If you don't have a consent form, then I cannot grade your paper. So by the end of this week, please have your consent form filled out and your practice video. And by the end of week 2, you're going to have your final video submitted. And for this video, you're going to be choosing one patient. It can be a child, a 6-year-old, up to a school-aged child, or a geriatric patient. And for this video, you can't use your own child, and you'll need to get a consent either from the guardian or the parent. So, after you've done that, you want to scan it, and then upload and submit it. And for this video, you're going to treat it like you're in a real clinical environment. Be professional, dress professionally. You can wear scrubs. Treat the patient as you would want to be treated as a patient. Keep in mind the person you choose needs to be able to engage with you, especially for the teaching part. So that's the second component of your video. And choose someone that's able to engage with you, someone that can be part of the teaching process. So the items that you're going to need for this video for your assessment are your stethoscope, a watch with a second hand, a pen light, and some hand sanitizer. If you don't have hand sanitizer, it's acceptable to say, I'm washing my hands. So verbalize what you're doing in the video. And to that point, for this video, it's very important that I can hear what you're saying and see what you're doing. So make sure that your lighting is good. That needs to be recorded on video so I can see everything since I'm not there with you. Also for this video, the environment you record needs to be conducive to the video. So just be sure there's no light glares and no bright backgrounds. There has to be good lighting as well as good sound control. So ideally there would be a third person recording for you. But if that's not something that you can do, then practice and watch your video back. And make sure that I can see and hear what you're saying. If I can't see or hear, I can't grade it. So be sure and test it, reshoot your video if you have to. My biggest tip is to practice short, several videos, and then watch it back to see if there's any areas for improvement. The maximum time for this video is 15 minutes. So for the assessment, patient teaching, all that needs to be done in 15 minutes or less. Anything after that 15-minute mark, I will not be grading. The second component is of this assignment is the patient teaching portion. So keep it simple. Choose one thing to teach the patient. Choose the most effective domain of learning. This can be a cognitive learning, which is where you would present written material into like a pamphlet about a specific topic. For example, a heart-healthy diet or a diabetic diet. Teach them something about their diets. Or you may use affective learning, and this can include presenting a topic that might change their feelings about something related to their health, such as engaging in an exercise program or maybe vaccines. You know, maybe they don't use vaccines or get vaccines. You could change their feeling about that. Or you could try psychomotor learning, and this takes place when a skill is taught. For example, hand washing. You could teach your patient how to effectively, adequately wash their hands for 20 seconds, and then you would watch them back. It's similar to teach back, and some of you may have heard about teach back. You want to ask your patient open-ended questions where they cannot say yes or no, such as, do you understand your discharge instructions? That's a yes or no question. So you would say, can you tell me how many seconds would you wash your hands? They have to give you an answer of 20 seconds. Okay, so This is also like an opportunity to catch problems. So if there's something that they are not successful, they don't understand, this is a great opportunity to teach them and make sure that they're following it, especially when we're discharging patients. And you know your patient better than I do. So these are just examples that you can choose. Just choose a topic that's appropriate and applicable to them. It's important to keep it simple and choose one topic, and don't use medical jargon. Patients usually don't know what NPO means, or an MRI, or a cabbage. So use layman terms and practice. Choose your topic and practice before you start shooting your video. So we went over due dates. So at the end of Module 1 or Week 1, I need your consent form, your practice video, and at the end of Week 2, I'm going to need your final video submission for the final video grade. So depending on who you choose, I do want to mention, if you choose a female, they are not to have their chest exposed. They're going to be wearing either a sports bra. If they're not comfortable with that, they can also have a tank top or a camisole. For the male patient, they can have their shirt off and wear shorts if they feel comfortable. If they're not comfortable with that, they can wear a t-shirt for the video. So when you're working through the body systems, just like you would in a clinical environment, use a drape, a sheet, or whatever you have on hand that will keep the certain areas covered of the body that you're not working on. So when you're listening to bowel sounds, for instance, if they're comfortable, they can just lift their t-shirt up a little bit. But if they're not, then you can keep it draped while you listen. It's very important to assess their comfort level at all times and maintain that comfort level, and also the safety of the patient and yourself throughout the video. So for this video, it really is dependent on what they're comfortable with. So if they're comfortable wearing a t-shirt for the males, or not wearing a t-shirt for the males, and then either wearing a sports bra and or a tank top camisole for the females. So again, for this video, it's 15 minutes. It's a short period of time to complete your assessment along with the teaching component. So it's very important to practice. Look at the checklist. You can go through the checklist and memorize it, practice it, be comfortable and confident with the checklist. And create your video. Please do not read the checklist on your video. I want to also talk about the resources that you have available to you on Canvas. And this will help you create a really successful video. So if you open your Canvas and you go to Module 1 and you open up the tab that says Reading and Materials, there is, under that section, there's going to be a trace video called Brief Bedside Assessment. So watch that video, and you can watch it multiple times, and then that's going to, excuse me, that's going to help you see what's expected. It will walk you through the head-to-toe physical assessment. Then next, you can go to your home page on Canvas and click on Course Essentials, and then click on Practice Experience Resources. This is where you're going to have the rubrics. There's several resources such as rubrics, but you can work through the rubrics. Start with that first. In this course, there's a rubric on every assignment, and the rubric is basically a checklist or a list of things that are expected. That's what I use to grade your papers. So it will point out each section that's needed, what's needed in that section. This is going to tell you exactly what's expected for each assignment, and it helps you earn maximum points. So next, you're going to check out the student instructions. This will give you more detail as well, and to view on the assignment and the expectations for the assignment as well. Then also the checklist. So you're going to be assessing the neurological, the neck, the lips, oral cavity, mucous membranes, the upper extremities, the apical pulse, the chest, the lungs, the abdomen, even the lower extremities. It's important to keep in mind that you need to verbalize what you're doing. Verbalize the landmarks for the apical pulse. Verbalize findings. Are they normal or abnormal? Breath sounds. Are the lungs clear bilaterally, or are you hearing wheezing or crackles? Verbalize all your findings. Since I'm not there with you, I need to know what you're assessing. Now, there are technology guidelines under the Course Essentials Practice Experience resources, so check out these links. There's one that shows you how to record your video and how to upload your video. These will help you create a successful video. It's important to do your patient identifiers before you start. So you will need 2 patient identifiers, their name, first and last, and their date of birth. And you also want to introduce yourself, such as, hi, my name is Dr. Christina McCall, and I'm going to be doing your head-to-toe assessment today. So for the assessment, you want to start at the head and work your way down. Start with the least invasive, because it helps you build some morale with your patient and trust. So you don't want to start with a chest examination. Start with orientation, maybe the eyes. So my overall pointers for this is, number 1, be organized. Have all your equipment available for the video. Practice. Make sure I can hear what you're saying and see what you're doing. And number 2, make sure you include hand hygiene before and after your assessment. And number 3, make sure you get the 2 patient identifiers and introduce yourself. And lastly, treat this video like you would in any clinical situation. Be professional, dress professional. And again, as I said before, you can wear scrubs. Treat that patient as you would want to be treated as a patient. So I think that's about it. I hope this was helpful. I have an open door policy. I have office hours, so you can make an appointment by emailing me on Canvas. And I can set up an appointment with you anytime that's good for you. I'm excited to be with you this term, and I look forward to seeing your videos. Thank you.